I thought it would be a good time to ask you about your work raising awareness on suicide in India, and whether you actually have any data on the impact of COVID-19 on suicide rates amongst different communities.
So the National Crime Records Bureau does collect data on suicides in the country. Now, there are lots of problems with the NCRB data, largely to do with underreporting. So probably it's underreported to the extent of 30-40%, even 100% if you went by the GBD data. But that's only one part of the problem. The second part of the problem is that the National Crime Records Bureau does not release the data early enough. Normally they will release data after 12 months or 24 months in arrears, and they tend to release data in summary statistics rather than release the data. So for example, they won't release monthly data, so it's very difficult to then correlate whether there is an increase in suicide or there isn't an increase in suicide. So some of us have been looking at, say, for example, media reports of suicide to see whether the media reports of suicide are presenting a different profile. You can't really estimate numbers, but at least you can check whether the media reporting of the profile has changed. 3 different large cities, the police commissionerates have reported increase in suicides in the months of May and June. So they dipped in April and then they went up in May and June. That's been their experience. Again, this is very small area data, and the police commissioner data in that sense is a bit more reliable because that's the data which feeds into the National Crime Records Bureau data. But it's small area data. You've got police commissioners in Pune, Kolkata, Ludhiana. So this is 3 different parts of the country and in 3 large urban settings reporting some increases in suicides in their jurisdiction. Anecdotally, if you talk to people, especially, if you see, for example, there's been much more reporting around, say, doctors' suicides or junior doctors' suicides. And that's really taken up, there's been a very active discussion, not only in media, social media, but also among the officials as to what are we going to do about that. So, I think my guess is probably as good as yours, but based on the little data that we have, it appears that there is some increase in suicide rates, or at least the profile of the suicides seem to be changing. So, it seems to be happening differently. But unless we have good quality data, or unless we have some national data, it's difficult to draw conclusions. So many of us have been requesting the National Crime Records Bureau to actually release the data sets early enough so that we can start looking at that data set and try and make sense of it from a researcher's perspective. And for attempted suicide, we just don't collect any data. So what you're left with is only anecdotal data.